Hi, my name is Hitomi, and today I will conduct an interview session with you. So I will ask a few questions regarding to your background and also the injury condition. Okay, so the first question, can you introduce yourself?
Hi, my name is Muhammad Hamzah bin Muhammad Yusuf and I am 25 years old.
All right, so can I know what sports you involve in?
I involved in badminton.
Okay, so how long did you involve in the badminton sports?
I involved in these sports around more than 18 years.
All right, okay, more than 18 years. So what type of injury are you experiencing right now?
I am experiencing an ankle sprain.
Ankle sprain. Okay, so how did the injury occur?
The injury occurred while I'm doing a forehand lifting shot
Mm-hmm.
when I'm extending my left leg, and then suddenly I feel a twist at my feet. So that is why that is all that happened there.
I see. Can you show me where or which part that you feel pain?
I feel pain at this part on my
Okay,
left side.
all right. Okay, so from 0 to 10, how many you will rate your pain?
I will rate my pain at 7.
7. Okay. So during injury, do you notice any popping or clicking sound?
During the injury, I noticed one popping sound,
Mm-hmm.
and then I feel so pain there,
Mm-hmm.
and then I just rest outside.
Okay. So can I know after the injury happened, what initial treatment did you get or did you do other than you rest?
So other than rest, I just put some ice, and that's all.
Okay. Okay, so next question. Does your injury getting worse or getting better?
I can feel my injuries getting better since I'm just resting and putting some ice and not pushing too much there.
Okay. During resting time, do you feel any pain at the injured part?
During resting time, I just feel some injuries when I'm doing movement or rotation on my left feet. That's all.
Okay. So how about when you do a daily activities, do you feel uncomfortable?
For daily activities, walking is good,
Mm-hmm.
but sometimes when I go from walking straight to the other side when I want to switch, I feel slightly pain there.
All right. Okay. Slightly pain. Okay. For the last question, when you are sleeping, do you feel pain that make you awake at the night?
Usually, I don't feel any pain, not
Oh,
that serious.
okay. All right. So that's all for the interview session. Now we will go to the next session, which I will evaluate your postural alignment. Okay. All
All
right.
right.
Let's go. Right, so the next session is I will evaluate your posture alignment. Okay, so what you need to do is you just need to stand comfortably with your feet hip with the car, right? And then your hands at the side. Okay, so for the first, I would like to evaluate your anterior view. Okay, so you can face the camera, stand straight and hands at the side. Right. Right. So for the anterior view, your head, shoulder, hip, knee, and ankle are normal. Okay, so now for the posterior view, can you face backward? Okay. So for the posterior view, head, shoulder, hip, knee, and ankle also normal. Okay, can you turn to the side for the lateral view? Okay. The head, shoulder, hip, knee, and ankle also same as like anterior and posterior view is normal. Okay. Next, I would like to observe your walking pattern, which need you to walk in a straight line. You may just walk as usual and under comfortable condition. progress in recovery. Okay, so I will use a visual estimation and some simple movements to gauge your ankle's flexibility and movement. Right? Let's measure dorsiflexion. Okay, please sit comfortably. Please sit comfortably with your legs extended. So for the dorsiflexion, slowly bring your injured foot towards your shin as far as you can and hold the position. Okay, on my count, 1, 2, 3, 4, 5. Okay, relax. Next, we are going to measure plantar flexion. So point your injured foot downwards. Now we are going to downwards, away from your shin. So move slowly and feel the stretch and hold that position slowly. Okay. Okay. On my count, 1, 2, 3, 4, and 5. Okay, relax. Okay, now we will do the uninjured ankle. Okay, to tap both of them. Okay, right. Okay, we do dorsiflexion. Okay, so slowly bring your injured foot towards your shin as far as you can. Okay, on my count, 1, 2, 3, 4, 5. Relax. Okay, next we are going to do plantar flexion. Okay, point your injured foot downwards, away from the shin. Okay, hold that position. 1, 2, 3, 4, and 5. Alright, good. Okay, you can relax. Okay, so I observe and estimate the range of motion visually. For dorsiflexion, I'm looking at how close your foot gets to your shin. And for plantar flexion, I'm noting how far your foot points downwards. Okay, so how does that feel? Any discomfort or pain?
Yes, but my left.
Because your left foot is not injured, right? So yes, of course you're going to experience the discomfort, right? Now I will conduct the strength assessment. Typically focuses on evaluating the strength and functional capability of the muscles surrounding the ankle, for the ankle joint. Okay, so you will do 2 functional tests, which is single leg balance and single leg standings, eyes closed. Right? So we start with the single leg balance first. So what you need to do is you stand on your injured foot, right? Lift up your uninjured foot, okay? And hands on the hips, right? Up and hold the position for 20 seconds. Alright? Can you do that? Alright, so facing the camera please. Okay? Hands on the hips. Okay. You can lift up your right leg. Okay, ready? In 3, 2, 1. Okay, it's okay. Okay, now we try the uninjured leg. Okay, lift up your injured ankle. Ready? In 3, 2, 1. Your hands at hips, please. Alright, okay, good. Okay, the next one is single leg balance with eye closed, right? So what you need to do is same just like this now. Okay, you lift up your uninjured leg and you can put your hand aside for the balance, and while there you kind of need to close your eyes. Feel like this, for example, and you hold the position. Alright, okay, we start with your injured foot first. Okay, ready? In 3, 2, 1, up. Okay, here we try the uninjured foot. 3, 2, 1, up. Good. Alright, okay, good. So throughout the examination, I observe swelling around your ankle, tenderness when I touch it, and notice that you have difficulty when you're moving your ankle, right?
Yes.
So based on these findings, it appears you have moderate ankle sprain.
Oh, really? What is that?
A moderate ankle sprain means there are significant stretching or partially tearing of the ligaments around your ankle. It's not as severe as a complete tear, but it does require careful management to ensure proper healing and to protect further injury. Typically, moderate sprains like yours can be managed by a RISE protocol. So in the next session, I will explain to you a suitable treatment for your injury. Okay?
Okay.
Now, I will suggest you the treatments for your injury. Okay? First of all, I would like to ask you, how do you feel after all the session that you have been through?
I feel much more better, and now my movement is getting better, and also my emotion. Everything goes well and almost to my normal state.
I see, that's good. So I noticed that you mentioned you are using an ice for your ankle for the initial treatment. So can I know how do you apply it?
Usually I apply it every 1 hour, 2 times for 10 minutes.
Okay, so right. So actually the method that I will suggest for you is similar to the ice technique, but I would like to add the other three elements, which is the RISE protocol that I mentioned just now. So have you heard the RISE treatment or RISE protocol before?
No, never.
Alright, it's okay. So now I will explain. So it's a very simple treatment actually to cure your injury, which is R stands for rest, alright? So you need to stop any activities, or you need to stop a while from playing badminton, okay, to allow the healing process.
Okay.
Okay, so next is I. I is for ice. Okay, so like you mentioned earlier, you apply the ice, but you can apply the ice pack or cold therapy for 15 to 20 minutes, 3 to 4 times a day, especially after activities that may stress your ankle. The third component is compression, where you have to use an elastic bandage to wrap the ankle, okay, like you do now, alright? It's a correct method. And lastly is elevation. Elevate your ankle above the level of your heart using pillow or cushion. Okay. So however, if the RISE treatment is not effective to you, I'm going to suggest few other treatments that you can do.
Okay.
So first, you can do X-ray. This is because it can produce image of the bone on ankle. Okay. Second is MRI. It can produce 3D image of soft internal fracture of the ankle. Okay. Third is ultrasound. It can produce real-time image. And so that is three other few treatments that you can do if the RISE treatment doesn't suit you. Okay. So that's all about the suggestion and recommendation for your injury. Okay, so that's it for this session, and I would like to thank to you for your cooperation throughout the process. So after I'm done with my research regarding to your injury, I will give a copy result of the evaluation to help you improve your recovery journey, as well as you getting back into your sports in badminton. Okay, so that's all from me, and I wish you all the best, and thank you for your time.
Thank you.